Hello, everyone. Welcome back to another edition of Let's Keep Moving with the APDA. My name is Teresa Baker. I'm one of the physical therapists at Boston University Center for Neurorehabilitation, which also houses the APDA National Rehab Resource Center. And we're so pleased that everyone's able to join us today. This is the first of a three-part series related to balance. And today's topic is Balance 101, Understanding Unsteadiness. And we're so pleased to have Tim Nordahl today as our presenter. And we'd love to turn it over to Tim.
Hi, thanks, Teresa. Thank you for the introduction. Like Teresa mentioned, I'm Tim Nordahl. I'm a physical therapist with the Center for Neurorehabilitation at Boston University. So I've got a picture up of our campus there. It was a little snowy this morning, which took us all by surprise, but we're taking it in stride. Hope you all are doing well, and if you can, please do just say hi and tell us where you're joining us from in the comments. So again, we're going to be talking about balance and the ways that it is affected by Parkinson disease today. And I wanted to introduce the fact that we're planning a three-part mini series on Let's Keep Moving, which will be occurring over the next few months. So today, my job is to lay out sort of how the balance problems occur with Parkinson's. So when they start and the sort of profiles and ways that your balance can be affected by Parkinson disease. And today, I definitely will include an overview on how we try to best manage balance problems in Parkinson's. But I definitely hope that you will keep an eye out for the next installment in the series where we'll be going into a much deeper dive on the specific exercises and ways of managing that. So to get us started, we should quickly describe the scope of the problem. Studies that include a recent large sample from Parkinson's UK show that balance and falls are a top treatment priority for people with Parkinson's. In fact, in the example I'm thinking of, they had asked people about what their top treatment priorities for their disease overall were, and balance was actually the second most cited motor symptom. So this is a major concern for people, which is part of why we decided to put this mini series together. Um, and I think it makes sense to say this, but balance problems are known to cause people to restrict their activities, and it can have an impact on quality of life, as well as leading to injuries if the balance problems are severe enough to cause falls. So this is kind of already a very important and heavy topic to talk about. Um, Another thing that I want to mention, and I'm very curious to hear from you all, just sort of where you're coming at this from. So if you're, recently diagnosed, or maybe you've had Parkinson's for a few years and you're having falls already, sort of where you're approaching the topic from. But one thing I wanted to point out, and you'll see as we go through the next few slides, is that we have very often describe balance and falling in particular as something that is a consequence of later Parkinson's. So the graph, if you look at this graph on screen now, you'll see the motor symptoms of Parkinson's and how they're traditionally described. You'll see that as time goes by along this graph, we have falls and postural instability listed in the later years of Parkinson's and kind of like the more severe stages. Um, but a point I wanted to make today, and I think some of you have probably noticed, is that we're starting to see that as we refine how we study balance problems, we're actually noticing some changes that start to occur earlier in Parkinson's. More recent studies have shown that there's an increased risk of falling in early PD compared to, controls, so people in similar age groups that don't have Parkinson's. Um, Even going as far back in some studies as showing that people had more falls prior to their diagnosis even occurring. So that's something that I want to point out because I hope this is just a relevant topic for anyone, no matter kind of where you're approaching this topic from today. Um, Not to scare you, but more just to give you more information about what to look out for and when to see someone about this. Okay. Another thing that I like to do is just be careful about making sure I'm not using too many like very specific terminology here. So I like to just step back and talk about what we mean when we say balance before we really get into how Parkinson's is affecting balance. Um, I always try to teach patients in my clinic that balance is not really just one thing. So in our field, we have a term that we use called postural control, and that's a little easier to define. It's just your ability to keep your center of mass within your limits of stability during a particular task. So I put up a picture here of someone doing a balance exercise, and these red lines kind of represent the width of his base of support, because you can see it's on either side of his feet. The yellow arrow is kind of pointing where his center of mass would be. So as long as he keeps that yellow line, which is kind of like around your belly button, in most people, in between those red lines, you won't start to fall over. Um, so that's a very basic example of keeping your postural control. And I'd like us to think about balance like this because it encourages you to take into account the specific activities you're doing at the time and how those create different demands on your balance. So just as a quick example, if you're sitting on the edge of the bed, you can imagine that requires you to keep a different posture and different patterns of muscle activity to hold yourself up compared to, say, getting on your tiptoes to reach for something out of your kitchen counter. So the activity you're doing at the time also affects how you need to keep your balance. Now, another thing about balance is that it's a complex coordination of many different body systems, which include your sensory systems, your eyes, your inner ear, the joint position sense in your feet and ankles. Your neurologic system, obviously, that's a lot of what we're going to talk about today, and your musculoskeletal system. So the image I have on this slide is an overview of the neuroanatomy involved in balance. And you can see that this is a very complicated schematic. There's a lot of arrows pointing in a lot of different directions. One of the things I wanted to point out today is that the dopaminergic system, so the system affected by Parkinson's, you can kind of track it down in the middle of the screen, the basal ganglia, which is that black part of the middle of the picture, is the system primarily affected by Parkinson's, particularly in the early and moderate stages. And that's just one component of this entire system. So you can see that there's a lot of other parts of the brain and a lot of other neurologic signals other than dopamine that are involved in the maintenance of your balance. So we'll come back to this point in a few minutes. But we also assume that just the complexity of this system may be one reason why people don't always experience as much improvement in their balance from taking their usual medication as they do other symptoms like tremor, which is usually pretty well controlled by the typical Parkinson's medications. All right, so moving on, I'm now going to go over some of the ways that Parkinson disease or even some specific Parkinson's symptoms can affect your ability to maintain your balance. Um, I think really the main goal of going into this level of detail is to help you try and identify some of the patterns that like Teresa and I would see in the clinic to help you think about what activities might be riskier and how to help you keep up with your usual kind of desired level of activity and quality of life. Um, First, we can talk about a category we call biomechanical constraints. Um, so when you think of Parkinson disease, one of the first symptoms that comes to mind, it's considered a cardinal symptom of Parkinson disease is rigidity, which is that increased resting activation of your muscles that makes you feel stiffer. And this can be particularly problematic in your core and hip muscles in Parkinson's. Um, and this and the commonly described sort of stooped posture in Parkinson can affect your balance. So on the right, you can see a schematic of what researchers have found when they compare how stable people with Parkinson's are in response to little nudges or perturbations in different directions. So you can see kind of like the up is forward, down is back, and then you've got left and right. And this little circle in the middle that's red is the people with Parkinson's. And they wanted to see if the posture specifically was part of the balance problem for people with Parkinson's. So they compared people with Parkinson's to people who don't have Parkinson's but have a similar stooped posture, which is that circle in the middle, to other controls that didn't have the stooped posture, which is that circle in the outside. And what you can see, in all directions, they're a little bit less stable, but particularly in the backwards direction, which maybe a lot of you have noticed, is that you're less stable if you start to tip or fall backwards. And because they saw a similar but not quite the same pattern in the Stoops controls, they were thinking that this is a way of sort of supporting the hypothesis that this could be partially related to that trunk position. And back to the rigidity, we also know that rigidity can impair your turning and rolling motions. And researchers have also seen slower turning in people that were recently diagnosed with Parkinson's. So again, before we traditionally consider them to have balance or fall risk, they've seen that people actually turn more slowly recently after their diagnosis. Another aspect of balance that we know is affected by Parkinson disease is anticipatory postural control. This is just a term that we use that describes the body's ability to sort of make small adjustments in preparation for a task. So, for example, some real life scenarios, including the one on screen right now, is just the way that if if you were to try to step forward with your right foot, you have to shift your weight, which you can see those lines are representing the weight shift. You have to shift your weight onto the left foot to step forward with your right. Um, or you can even imagine, your muscles have to prepare and you have to shift your weight a little bit, even just to, again, going back to reaching for the cup out of the cabinet. So these anticipatory postural adjustments are affected by bradykinesia. That's, again, that medical term for the slower, smaller movements that people with Parkinson's have. You think of it with those bigger movements that you watch and see, like maybe you take smaller steps than you mean to, but they also affect these anticipatory postural adjustments. Um, so just again to show you a schematic pulled from the literature, you can see that these researchers compared people with Parkinson's in yellow to age matched controls in pink and a younger control group. And you can see that the size of the weight shifting onto the left foot before they step with their right is a little bit smaller. Um, Another major area of concern for Parkinson's disease is what we call reactive postural control. And that's a term that refers to the body's response to a loss of balance, such as a sudden slip or a trip. And we can do various things like kind of pull our shoulders back and keeping the feet in place. And also actually taking a step if it's a larger perturbation that actually gets you completely knocked off balance, you sort of have to step out to catch yourself. In both of those cases, scientists have found that people with Parkinson's disease have slower and smaller patterns of muscle activation in response to this loss of balance. They also use the term inflexible, which kind of refers to not necessarily the rigidity. It's more that it's hard for people to adapt. Because the basal ganglia is supposed to help make our movements more automatic and update. But if you're kind of doing a twisting loss of balance instead of moving in a straight line, your reflex might be the same. Or if you have a small and then a big loss of balance, that step might be the same size in people with Parkinson's instead of people without Parkinson's. So that's what that inflexible pattern of muscle activation in response to a loss of balance means. All in all, this just kind of causes it to take longer and or be harder to recover your balance after a perturbation. Um, This is also one of the reasons that if your neurologist is testing your balance in the office, chances are one of the major ways they do that is the pull test where they're pulling back on your shoulders. That's actually to see if you're stepping back with a good big quick step or if you're taking the smaller steps. Okay, and then uh, sorry. Oh, sorry. Yeah, just advancing. So then one other major area we should talk about is balance while walking. And this could be a whole separate presentation. So I think I'm going to try to just go over a couple of key highlights here for you to think about because we really may need to just have an entire show just on this. So let us know in the comments if this is something you'd like more detail on. Um, but we know Parkinson's has several specific effects on walking, which can also lead to unsteadiness. Something you may experience are slow or shuffling steps, and that can make it more likely you could catch your foot or trip on uneven surfaces. People also tend to walk with their feet closer together, and researchers also think maybe that's a compensation for those small weight shifts we talk about. But that can also lead to unsteadiness because you have less of a limit of stability from side to side. You can you can imagine if your feet are a little bit farther apart, you have more room to move while keeping your center of mass in between your feet, as opposed to keeping them narrow together. So these are some changes to gait that happen without you being aware, and it's difficult to completely get rid of that on your own. Um, in addition to those kind of constant gait changes, we also have episodic gait symptoms like freezing and festination. Now, these we definitely have a full series on, and let's keep moving. We may need to revisit freezing and fascination as well, but they are a known issue with Parkinson's that lead to a high risk of falling. So these are common problems that also occur with Parkinson's disease, but they come and go as opposed to being constantly affecting your walking. Um, we know that turning and moving around obstacles is more challenging for people with Parkinson's. And a major point I want to make here is that the loss of dopamine into the basal ganglia again makes your movement less automatic. So your day-to-day mobility requires a lot more concentration to get you from point A to point B. So people with Parkinson's show that they're more unstable when they're having to think about something while you're moving. This is something you may or may not notice if you're out for a walk and let's say like a family member you're with asks you a question, you may get really unsteady or start to shuffle a lot more while you're trying to answer them. And we call this term divided attention. And this is a particular time when you'd want to be very aware of problems with your balance. So some people actually have to just, stop and answer the question and then keep walking. That's sometimes just the quickest, safest way to do this. So I had alluded to this earlier, but this was a study of certain laboratory measures of gait and balance where they had people tested off medications and then they took their medications and once they kicked in, they repeated the testing. So this is a common question we get, and like I said earlier, people don't always find that their balance gets better with the medication. Maybe it has a great effect with your tremor or your stiffness, but it doesn't always help people with balance in the way they're hoping for. So I wanted to just leave this study up and cite them so that you understand this is actually a commonly known issue um, in our field. So you can see the balance and gait measures are all listed there. If there's a line moving to the right, it means that it got a little bit better or got a lot better with levodopa. And if it is moving to the left, it got worse after taking levodopa. And you can see there's some of those smaller lines in the middle were smaller or harder to detect changes. Um, One of the key points I think of as I look at this is that um, a lot of the gait measures that got a lot better are some of the things that are affected mostly by the bradykinesia. So particularly things like swinging your arm more, taking longer steps, moving faster. So the gait cadence actually improved just from taking the levodopa. Um, but some of those static balance things, for whatever reason, actually got a little bit worse there. So this is just something to be aware of when you're talking with your neurologist about your balance problems. And then finally, before we go out to your questions, I just wanted to point out something about fall risk in general. And I think this is something as physical therapists we have to be aware of because when we look at fall risks, not everything is related directly to balance. So I'm just wanting to leave this up for a few seconds so that you can review it. Um, but it's a summary of fall risk factors. I wanted to point out in this case, they have what they call generic risk factors. So these are things they don't consider directly related to Parkinson's. But you can see how things like mood disorders or taking more than three medications or orthostatic hypotension, which is that lightheadedness, getting out of a chair really quickly, all sorts of other environmental factors and health conditions are going to have an impact on fall risk, and those aren't directly related to Parkinson's. In my mind, the point of bringing this up is so that you understand kind of staying on top of your fall risk is really a team effort. So if you're having concerns about falling, I definitely would recommend um, reviewing these sorts of risk factors with both your primary care and your neurologist, and ideally seeing a physical therapist to make sure that you're on a individualized exercise routine to help you with your symptoms. And just to hit that point one more time, I hope you've seen that balance is complex, and there's a lot of factors that affect it in Parkinson's disease and in general. And the point of thinking in these terms about balance is to understand ahead of time what activities might be riskier for you and help you think about how you might be able to modify some of those activities so that you can keep doing them but stay as safe as possible. And at the end of the day, um, I would really like to emphasize that exercise is one key component of helping with fall prevention. On the right, I have a recently published meta-analysis and Cochrane review that Natalie Allen published, and this shows you it's the highest form of evidence we can find, but it shows you that when they look across the literature in general, exercise can have an effect on reducing the risk of falls. So that is just a very quick teaser, but I know we'll be going into a lot more detail on this point in 2 months when we have our next installment. So with that, I just wanted to put up um, the APDA exercise helpline. So this is a free resource available here. Um, the APDA sponsors. So if you call or email the information listed on screen now, you'll be able to get a hold of one of the physical therapists at the center, and we'll be able to reach out and help you with resources or help you with your any specific questions that you have. We'll get next to the question and answer. So here I'd like to pull Teresa back on.
Tim, thank you so much for such a wonderful presentation and an overview of just how much goes into balance. That was fascinating.
Oh, thanks, Teresa.
We had some wonderful questions from the audience ahead of time, actually, and we've been looking at your questions during the presentation that you've been able to write in. So thank you for all these questions. And we acknowledge we aren't able to get to all of them, but we've made a note of all of them and we're saving them in our office to specifically help us design future programs, including the next two episodes that are very dedicated to balance. And the other note I'll say about questions related to medication and balance, if I could refer you to uh, the APDA program Dr. Gilbert hosts, which is archived in YouTube and has its own playlist. There's so many episodes in there, and I think you'd find some information about medication. And then also kind of addressing those specific questions with your own neurologist is really the best way to go. Um, but uh, among all the questions that have come to us, Tim, I wonder if I could kind of pass along a few to you. This was actually getting at a point I think that you made. Someone is writing in here that observations that their balance issues kind of snuck up on them, that they're less than a year into their Parkinson diagnosis, and they thought they wouldn't have had balance issues for several years to come. Just for reference, they indicate that they're 60. I wonder if you could kind of comment on that as you've sort of mentioned.
Yeah, it's great to hear because that actually is the specific scenario I kind of had in mind when I included that graph of sort of the traditional understanding of the progression of symptoms. So yeah, again, we're starting to see that as we get better at measuring this, there are changes that happen a little bit earlier, or possibly depending on when you're diagnosed. It could be even before diagnosis in some subtle ways, but it's definitely good to keep up with your neurologist. And I think if you're noticing it, it would be good to see a physical therapist who specializes in Parkinson's disease because um, we may be able, even if it's not severe, we could just meet with you and review your exercise routine just to make sure it looks like you're doing everything you can because I know we'll go into more detail on this, but actually you get the most bang for your buck out of exercise if you start early. So if you start early, there's actually better evidence for fall prevention and helping with your balance.
Thank you. Another question about what causes the tipping feeling while standing still?
Yeah, so this is actually, and I think if you can think back, maybe we can even pull up slide 8 again. So this is that sensation that you have if you're thinking of that little red circle inside of the two larger circles. That's part of that tipping feeling. So very tiny shifts in your balance will cause more unsteadiness. And particularly, you maybe are noticing it backwards. There's definitely some individual variation in that, but that's actually a good way of describing what this graph is showing here.
Absolutely. Um, I think we have time for kind of one more question. This question is, when I fall, I don't remember any part of falling. Is that normal? Or could it be that I'm blacking out?
Mm. Yeah, that could be the case. I think I would want to even possibly pull up slide 13 again while I tell you a little bit about that. Um, if you don't remember the incidents, I would really encourage you to talk about that with your primary care and your neurologist as soon as possible. It could be related to orthostatic hypotension if you're not remembering the incident. So this is in this summary of risk factors, they considered it a generic risk factor because it's related to any number of things, low blood pressure, dehydration. It can be related to autonomic dysfunction from Parkinson's too. Um, and this is something that would need to be addressed through your neurologist, just for your safety as quickly as possible. But that is one of those risk factors that you would consider non-motor. So it doesn't necessarily have to do with your reaction time or your stepping response. That would definitely be something to check with them about.
Absolutely. Tim, I can tell this program has generated so many questions, and we have a number of different questions about how physical therapy can influence exercise, influence balance rather, a lot of questions specific to what particular exercises would help balance. We have several people who've written in about what about bicycling. So I can tell this is all information that we'd love to present in the next series, the next episode in this series about balance, because there's quite a lot of questions and definitely interest in the audience today. There was at least 4 people, Gail H, Gail D, Eileen, Nancy, who wrote in that they'd be very interested in more information about walking in balance. So I think we have a lot to go on for these next couple episodes, and that's really what we want to do. Today was a wonderful introduction, Tim, and we appreciate it so much.
Yeah, absolutely. I think we definitely will give you more detail in the next installment of the series about kind of what specific types of exercise will help. But I think making sure you're on an exercise routine in general is very important. I know there's lots of group exercise programs for balance as well, but if it's possible for you, I'd really encourage to discuss this with a physical therapist as well, just so that you can have somebody really going through these risk factors with you and telling you which specific items would be most effective. So one thing I'd like to leave, maybe if I can pull up one more slide again. If we could pull up slide 15 again, just to have the contact information for the APDA exercise helpline. If you need help finding someone in your area that specializes in Parkinson's disease, don't hesitate to reach out to us.
Absolutely. That's something we would definitely love to help anyone with. And we appreciate everyone from the audience today, all the interest and the questions. And we'll definitely present on more of these questions in the next Let's Keep Moving. So we really look forward to having you back with us next time.
Oh, thanks, Teresa.
Hi, I'm Leslie Chambers, President and CEO of the American Parkinson Disease Association. Thank you so much for joining us today on our program. Every day, APDA is committed to providing helpful programs just like this one, as well as a wide variety of support groups, exercise classes, and educational programs to support the Parkinson's disease community. Whether online or in person, APDA is here for you every step of the way. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. We keep you posted on our social media channels as well, so make sure you follow us there. You can also connect to local resources and events through our nationwide network of chapters and information and referral centers. Remember, we're just a click or a phone call away. If you've enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Every gift, large or small, helps APDA support people living with PD through thoughtful programming, reliable resources, groundbreaking research, and more. Please visit apdaparkinson.org/donate today to support our critical work for those with Parkinson's. We are so grateful for your generosity.